What made you initially start this?
Start this?
I mean, because that's what the interesting thing for me is that Chris's knowledge for genetics is surprising. It's neat that he got involved in it, and he always it surprises me as far as the depth of his knowledge. And he's very passionate about it, which I think is really cool. That's actually what's driven, I think, this happening. So it's unusual, and I think that's neat. Arkana's an unusual place, and I think it gets really good people here, and I think Chris is one of them.
My passion and my driving focus is to, as much as possible, provide the most precise diagnosis of a patient's disease. That may be on a histopathologic level. Sometimes it may require more sophisticated techniques like molecular diagnostics, like next generation sequencing.
When you do a genetic test, the pieces of information you get are potentially prognostic, predictive, and diagnostic. And prognostic would be how something behaves when you don't treat it. Predictive would be how is it going to respond under treatment. And diagnostic would be like what I would use as a pathologist, but also a clinician. If you identify a specific mutation, it allows you to make a more solid diagnosis, a genetic diagnosis. So that's the value of genetic testing.
It's one thing to understand the need for a test and to know how to perform a test, but to really undergo the rigorous validation that's needed in order to offer a clinical genetic test, you really do need a fellowship boarded molecular pathologist, and that's what John is. So he just adds another layer of expertise to the testing to ensure that the accuracy is really what it's about. It's making sure that when we offer a result, we know 100% of the time and are confident in the accuracy of the test.
The value goes beyond the person, so that as you identify a genetic mutation, you have to take in consideration the patient's family and their other family members, brothers, sisters, their relatives, but also their children. And so that's, I think, what also makes genetic testing complex, that you're not only affecting the person that you're testing, that you're potentially affecting the rest of the people that they love.
When there is an unknown cause of a patient's kidney disease, that's the only reason you're going to put a needle and do an invasive procedure like a kidney biopsy. They don't know what's causing the disease, and so they send us the kidney biopsy. Most of the time, we're able to make a specific diagnosis of what's causing the patient's disease. However, there are cases, I'd say maybe 5%, where even after a kidney biopsy, even after this invasive procedure, all we can tell them is that there's some disease here that's causing chronic injury, but we can't give them a precise etiology, the exact pathogenesis of the disease. We have found in patients, particularly if they're younger than 50 years old, who have these non-specific changes on their kidney biopsy, in about 50% of those cases, we will be able to make a specific diagnosis, precise molecular pathogenesis-based diagnosis of the underlying disease. The doctor and the patient will know exactly why the patient has kidney disease. It may or may not have implications for treatment, but it's definitely going to help the patient understand what's causing their disease. It's going to have implications for sure for the family, oftentimes if they do have a genetic disease. And also, if there are ever treatments available, then it's going to allow them to pursue those treatments. They're going to know they have the disease so that they can pursue those treatments. Why did you come to Arkana Laboratories? Because you were primarily you've already covered this.
Oh, I did a little bit. We did a little bit. I came, one, because I had the opportunity to set up Neuropath, but the other one, too, is that I got to work in the molecular lab. It was, that was basically what drew me to it. And then the capability, the interest, other people wanting to kind of push to have it happen, to make it as patient and clinician friendly as possible. I think that's one of the things trying to do, as well as we have a really neat niche, and because it is a niche, I think it's possible to actually make it very, I don't know, user-friendly? I mean, like a lot of tools come into pathology, and initially they're kind of hard to integrate and everything else into just the practice of it. And I'm thinking that genetics is going to be just like a stain eventually. It just comes in. It's part of the workup. It really should be. And that's the interesting piece. But it not only just in the pathology lab, but it should go out to clinicians.
We're going to be a leader, I hope, in doing genomic analysis and proteomic analysis of renal biopsies as additional testing for the kidney. Just like we do light IF and EM, we're going to do light IF. Here's your genomic profile, here's your proteomic profile. And that's happening right this minute in the lab. We opened our genomics proteomics section about 18 months ago. We're now getting up to speed with some of these newer tests. I'm very excited about this potential. This is where medicine is going, and we're going to be there.